Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, as the legislature returns, its agenda moves center stage. Our all-star business panel is here to talk about some of the important issues before the legislature. And then Governor Corbett's Healthy Pennsylvania initiative, drawing lots of support and some criticism. We're going to have Scott Bishop on from the Hospital Association. He's going to help us understand the details of that. All of that follows these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, we're going to get right to it. We have our all-star business panel. Fred Anton, he's the CEO of the Pennsylvania Manufacturers Association, and Gene Barr, the president and CEO of the Pennsylvania Chamber of Business and Industry. These are our go-to business guys whenever we want to talk about the business view of what's going on in the state. We have Fred and Gene on the program. All right, Fred, let me start with you. I think that we're now poised for a vote on the $2.5 billion roads, bridges, and mass transit. It passed the Senate 45-5. Here's what's odd about this, and why this, if this doesn't pass, you have to throw up your hands and wonder why. You folks are actually in meetings with labor union leaders, and you're saying, let's get it done. Am I right or wrong about that?
You're right about that. Responsible people want something done so we won't have to close bridges, and so our roads will be in repair. But I regard Mike Terzai, the
majority leader of the House,
leader, saying that he will bring up the Senate bill for a vote as only the start of what should be, on a major issue, a process where they work through something. Now, the governor's plan is not as rich as the Senate Republicans' plan, and you could even appropriate less money to fix roads and bridges, which would still do something.
Yeah, but the governor, Gene, seems to be on board. We'll have him on a program. He can speak for himself. The $2.5 billion plan, you know, there's a point at which it covers mass transit. If you increase it too much, then you lose votes. You know,
right.
You got that bell curve going on there.
It's trying to work all the different sides of the interest. And again, we in the business community support a comprehensive plan because we have member companies where 50% of their workforce uses mass transit to get to work. So that has to be a key part of this, whatever we decide to do here. And you're right. We don't know what that final number is, but it's got to be enough that takes care of the roads, bridges, highways, mass transit. I talked to a state senator this week who said 4 bridges right around his town have been weight restricted. All the traffic's coming through downtown.
There isn't. I mean, look, there have been 3 gubernatorial study groups, 2 under Rendell, Governor Rendell, 1 under Governor Corbett. No one seriously, Fred, argues that this isn't a need. Have you read any arguments about the need to improve?
But Terry, there are 35 members, Republican members of the House, who will not vote to raise the price of gas, which is what would happen. The cost of gas will rise significantly, maybe not initially, but the number I see is 28 cents a gallon, and they won't vote for it. Now, what do you do about that?
Well, but that's all pegged, of course, to the wholesale price. If wholesale price falls, as that's tied to crude, who knows what happens, which is why the amount of money you get in the end can be a little bit uncertain.
Yeah, well, that's true, but look, we've had folks on this program for, it seems like before the fall of the Roman Empire, we've been debating this so long. But let's think about this. There is no doubt that it's now a safety issue. Yes. We all agree? Yes. Safety issue. Mm-hmm. How you guys want businesses? We all want, are businesses going to come into a community where the roads are dilapidated, deteriorated? What's the answer to that? I mean, you guys all know this.
That is a huge problem. It's the business side. It's the fire truck that can't get from this side of town to that side of town without a significant detour now. It's the truck making a delivery that can't cross that bridge. It's a school bus that has to let the kids off and have them walk across. It's all these things.
Yeah. But can something be done with less than $2.5 billion?
Well, the problem, it seems, from what people have told me who've come on this show and others I've talked with, is we only do this once every 15 or 20 years. You're not going to go back and revisit this next year or 5 years from now. So if you don't do a reasonably large-scale initiative, tell me if I'm wrong.
No, you're right.
You're not going to revisit it, and the bridges and the roads are still going to deteriorate.
You're dead on. The last time we did one was 16 years ago, 1997.
Correct.
We've not looked at it again since, and you're right, we won't do it next year or 5 years from now.
All right, before we move on, I'm going to ask both of you, how optimistic are you you'll get something in the neighborhood of $2 billion? Let's pick that figure just out of the clear blue, at least $2 billion comprehensive. Are you optimistic, Fred?
No, I'm not optimistic.
Really?
I think you'll get a bill of some kind through, but I'm not optimistic.
Gene?
I'm slightly more optimistic it'll be between 1 to 2. Slightly more optimistic, maybe closer to 2. I think something will get done. There's been enough pressure put on.
All right, when we come back, I'm going to ask our business panel about property tax reform. We'll get the liquor and pensions. We're running out of time, but it's commercial television. We'll be back in a minute.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Business Council Education Foundation, educating citizens and business leaders about important public policy issues and civic affairs. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back to the program. I have Fred Anton and Gene Barr. We're talking about a bunch of issues currently before the state legislature. I think we stopped with Gene. Let's go to Fred. All right. Property tax reform. It's at least 40 years old. They've tried statewide property tax relief, mostly talking about school district taxes, property taxes. By far the one that we hear the most complaint about. I think you guys would agree. But now there's legislation that would give local school districts options here to replace the property tax with, a mix of other taxes that they would increase. Fred Anton, what's the story here?
The story is, for as long as I can remember, and comprehensively and with detail, they've gone into, and they've had numbers for individual districts and so forth, to replace the property tax with the sales tax or the income tax or a combination. And the sales tax and income tax have been too high, and so it isn't fair to shift it in the other direction. And so I question whether they will get anything through here.
I once heard if you did it statewide to replace, I think it's something like 12 billion, it would be we'd be paying 13 percentage points on our
Might not be that high, but it's pretty high.
It's pretty high, yeah.
It's pretty high.
Does it make a difference if they just give the school districts greater autonomy to do this?
Well, it does, and here's the problem we have. One, we, from the business side, are not in favor of looking at this until we resolve some of those issues that drive property tax higher, such as prevailing wage. That's one. Two, we're very concerned about shifting from residential onto the business side and increasing cost on the business side and therefore impacting jobs. And three, I think we all ought to be concerned about the fact we're an old state, one of the oldest states, and anything that shifts it from people of a certain age who might be able to pay onto, say, young families starting out really has an adverse impact on the perception of Pennsylvania.
Yeah, the other thing about, I've been through this debate most of my career, and one of the problems is, Fred, that say what you will, and we all agree the property tax is unfair, the assessment system is broken. Everybody knows that, but at least it's predictable.
Exactly.
I mean, if you're running a school, Fred, you at least know what you're going to get. And once you start doing another mix of it, you change what people can do for their taxes, you change the predictability. I think that's also an element.
Yes, but there's so many senior citizens who are being squeezed, and they have a fixed income, and if their property taxes go up, and particularly with the aging population, it causes a real hardship. And that's the reason why it keeps coming up, in my judgment, because they've certainly Sam Rohr made a very, very comprehensive attempt to get something to solve this problem.
Sam Rohr, a candidate for governor. Go ahead.
And the seniors, of course, vote, call, send letters, but whatever we do, we need to look at it from a means test, because Fred's right. What we don't want to have is that elderly person forced out of a home because of property taxes. Right. At the same time, try and balance that with putting a too unfair burden on our young families starting out.
Yeah, and it's a tough decision. I mean, whenever you we're going to get out of time here, and I've got to ask you guys about liquor privatization. The state Senate just doesn't seem like it wants to move on it, just as the state House is having trouble. Gene, let me start with you. Liquor privatization, is it going to move in this fall session, or is
There's
it going
so
to
many
wait?
different wheels, and again, I'm not sure how to characterize where the House and Senate are. I mean, each of them there are pieces relative to the LCB, the Liquor Control Board. There are pieces relative to the private sector now, that is the beer distributors that sell beer who just want their own little piece. It's kind of all over the place. We, of course, would like to see greater customer choice and convenience. We think the private sector can do a better job, so we'd like to see changes done in that.
I think it is linked to transportation, and I think the outcome, if the House passes transportation, will be the Senate will do something very, very minimal on liquor reform. In other words, it'll just be a break in the system, wine in the grocery stores, some minor change that will.
So no comprehensive bill, maybe.
Bill.
Before we go, we're going to let you guys go, but we're going to do something on Healthy PA expansion. That's Governor Corbett's program to, in effect, expand coverage to a couple 100,000 folks who don't know it. That alternative, really, to Medicaid. What's the business community's response to that, Gene?
Well, right now we have 1 out of every 6 people on Medicaid. If we simply expanded Medicaid, the projections are we'd go to 1 out of every 4. We think what the governor has proposed is rational, it's reasonable, it's a great start to look at this issue, and really brings much needed reforms to the Medicaid system.
Most of the comments, Scott Bishop's going to come on here in a minute. We're going to get the, sort of the hospital views of this are obviously pretty important to them. Fred, you agree with this?
I do, but what I think there's big political gain for Corbett here. If he can make some sort of a deal, he will come off as a leader, even if it doesn't do that much. He will seem to be not just caving in.
Look, you guys are pros at this. Politics is never removed from much policy. I think you would agree. And I do think, on balance, politically, this will help the governor. You both agree there?
I would agree. If we can get something done, if he gets something positive back from it.
And I'm nonpartisan.
I'm not
partisan.
I think it does. And it also helps
objective.
the people who need this help.
Yeah, good point. All right, we're going to get into this Medicaid expansion. I can't figure out if it's 500,000 or 800,000. How many people are exactly going to be covered? I guess it depends on what the final agreement is on how the program would operate. Scott Bishop is coming on. He's going to straighten us all out. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania.
Welcome back to the program. As you heard just before we went to the break, we're going to talk about Medicaid expansion. It's really not quite that. Governor Corbett has a plan called Healthy PA that would cover folks not insured at the moment. These would be people that fall within a certain income level. They don't have health care coverage now. Scott Bishop, he's the senior VP at the Hospital and Health System Association, one of the experts that we call in, is going to help walk us through this. We're talking here about a lot of money and a lot of people. Do I got that right?
That's right.
Do we have any clue how many people could be covered? I can't even get a good number on that.
Yeah, so our number is probably the more conservative number. We're around 350,000. Folks talk about as much as 500,000.
Yeah.
So it's in that range but it's a lot of people.
It's a lot of
and
people.
you're right, a lot of money.
A lot of money. Okay.
Yeah.
So what is it exactly that Governor Corbett would like to do? This is not Medicaid technically. He wants to do what?
Right. So instead of simply expanding the current Medicaid program to people that at a little bit higher level of income,
okay.
Instead of doing that, he wants to take the federal dollars, bring it in, and use the private market to provide extended coverage to more Pennsylvanians. So some states have gone simply, the law allows them to expand their current Medicaid program as is to more people, just higher income level. The governor's concerned about the sustainability of that, doing that in the Commonwealth, and so as it's a kind of combination of those things. Leverage the federal dollars, but not put it into a current program.
All right, so walking through it another way. Let's say Scott Bishop were eligible for this. You don't have coverage now. Your income was such that you were in this gap. You couldn't get it.
Right.
You couldn't afford it, covered yourself, and you couldn't get Medicaid. So under the Affordable Care Act, dollars would come to Pennsylvania. Governor Corbett says, you're going to get, Scott Bishop, a certain amount of money. You would then take that money and go on the insurance exchange and shop around for coverage. Is that basically about right?
That's right. The idea, that's the private market part of it. So he takes you out of just be given the Medicaid and making those selections yourself. So that's the basic premise of what he's trying to do. And there are other states trying to take that approach as well.
Same approach. Now, I've had him on the program, and he's talked about this before. His problem with simply Medicaid expansion is that though the federal government pays all of it for 1 year, and I think 90% of it for a couple years, is his concern that down the road, 5-10 years from now, the federal government might cut back its expenditures for it, and the state would be left to pick up the rest or cut people from the Medicaid? Well, maybe you probably couldn't cut people.
I think that's part of it, and I think that's part of it. And the second part of it is concern about the sustainability of the current benefits package, the current things that the Commonwealth does. So it's twofold in that regard. And his approach is to try to say we want to make sure that the coverage is provided, and from his perspective, but at a sustainable rate, so that we're not on the hook for something.
All right, let's shift gears just for a minute. Now, I want to talk in a second about, can he do this? Will it get done? What's going on with the federal government, particularly Health and Human Services? But before I go there, the reaction within the medical community seemed pretty positive. I mean, you saw the business community say, well, it's they're good start, and the stuff I've read from coming out of physician groups and other groups that supply medical services are, this is a reasonable start. And everybody always says start.
Right. And that's the way the hospital community has approached it as well. I mean, it's a part of a comprehensive package to do good things in public health for the Commonwealth. And when it comes to extending coverage for that, we'll use the 500,000 number. We want to see progress in that regard. We've committed to the governor. We'll help try to get from the starting point, the proposal, to a final product. But it's moving forward, and that's what we want to see. All
right, we're going to run to a break. When we come back, what will happen with it? This plan needs approval from the federal government. And plus, I want to ask Scott about, what it means to hospitals with all of the care hospitals provide that they don't get compensated for. We'll do that in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Welcome back. We're talking about Governor Corbett, Healthy Pennsylvania plan. It's being debated right now in the legislature. I think that's fair to say, right? Legislature may have some input, even though the governor says he's going to do it. He doesn't need them, but that never happens.
They always have some say. So.
Yeah, they're always going to get their fingers in it somehow. All right, what are the roadblocks of this?
Well, the governor's proposal, I mean, it's aggressive with regard to what we've, I think, traditionally seen HHS think about when it comes to Medicaid coverage. So, for instance, governor has a job search requirement. Traditionally, HHS has not looked favorably upon that kind of thing.
You get the benefit, you don't have to look for work.
Right. The governor's proposal has a use of premiums, so not excessive or large, but nonetheless premiums for people who would get this expanded coverage. Traditionally, again, HHS has a pretty strict
so that means
looking at that kind of thing.
I'm using you're my example on the program.
Right.
So depending on where your income, you might have to pay $25, $35. I don't know what the
I think $25 is their maximum dollar they're talking about.
Okay.
But so $20, $25
so you'd have
a
to
month.
put up
right.
$25 a month, and typically that you're saying that's not.
They don't have a long history of embracing that kind of idea. But that's not to say that that's a part of the negotiating. It has to go on between the federal government and the Commonwealth. I mean, the federal government has a stake in wanting to make sure Pennsylvania provides additional coverage. And so from the hospital side, we're hoping that both sides figure out a way to come to compromise.
Yeah. I mean, that would be fairly unusual. But Medicaid, if I understand this correctly, it's a federal-state program. There are some variations in the Medicaid operation within the states now, correct?
That's right. So states are allowed to apply for a waiver of certain things.
Yeah, that's right.
And that works just as you would think. State says, we would not like to do X, Y, and Z, and the federal government has to determine whether or not, okay, we'll waive that requirement, we'll waive that one. So.
All right, I think we've covered the outlines of this. Now let's talk about the impact. What I hear is that lots of medical services are delivered to people that are uncompensated. Physicians and lots of folks just provide medical care. The hospitals have historically provided medical care. I think you're required under law, but you would
Right.
The hospital folks that I've talked with throw up their hands and say we're not going to even if it weren't the law, nobody's going to throw somebody out and not provide medical care.
No, right. So you're right. Federal law requires us when people present in the emergency room, we have to assess and see what care might be needed. But we're approaching over $1 billion now of uncompensated care in some form or another. And our expectation, our hope is that by increasing coverage, obviously, we cut into that $1 billion. And as you know, it cascades. So the less hospitals have to worry about covering uncompensated care, there's more money they can invest in other things, technology, office hours.
We have about 30 seconds left, but the other point is you could see, once the Affordable Care Act kicks in January, you could see a flood of people now accessing your facilities, right?
We could, but we think we're able to.
No, I know that, but that would be just another.
That's right. A
complication you're going to have.
Another complication.
Yeah. All right. I think we got it. Thanks for coming on.
Sure.
We'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.